Hi, my name is Karen Dudley. I'm a licensed professional counselor and a licensed marriage and family therapist, and for some of you, I may be your professor in this course. This week, we've been learning a lot about the ethical challenges and personal challenges in working with children. I feel that it is imperative for all of you to learn from professionals that are in the field about the ethical challenges that may come your way as you're helping children. So I would like to introduce you to some folks that are licensed who have been working with children for many years, and they're going to share a little bit about the challenges that they've experienced along the way and also pass along some practical advice to you as you continue to move forward in your education and your career.
After 22 years of experience working with children, both in their homes, in residential treatment settings, also in the criminal justice setting and outpatient settings, it does become apparent that there are some general things that emerge for children that are quite different than adults. One of those is that children are all at different developmental levels, and those developmental levels are important. They're not small adults. You can't work with them as if they are just a tiny version of an adult. You have to take into account not only chronologically where they're at, but also cognitively, which can look very different than what their age would suggest. And so I think always approaching children with that idea that I have to pay attention, assess, and work within their developmental space is vital to working well with children. Also, another common theme that we find working with children is how to balance aligning with the child, but also still respecting the parent and the parent's role with the child. At times you'll find that children will express that they don't want their parents to know certain things. And so I think being really honest with children about what has to be disclosed to parents and what you do keep between just the two of you is important. But then also having that same conversation with the parents on these are the things that we will talk about and these are the things that will stay within the setting of just the child and I. That does vary depending on your role, and I think it's really important to have those discussions with everyone involved on what that alignment will look like so that people don't feel betrayed by you when boundaries have to be crossed over.
Some of the challenges that I find working with children as a licensed professional counselor in Virginia and a licensed professional counselor supervisor in North Carolina, as well as working in several different settings, pastorally, in a church setting, in county agencies, in private practice, but also on military bases, is to develop trust within yourself and the child. You are seen in the eyes of the child as an adult, and oftentimes adults are usually who hurt children, even if it's their own parents. So as an adult, you have to spend some time to develop trust with them. Another aspect of developing trust is for you as the counselor, as the child caregiver, professional caregiver, to remember to be patient as you do so, because that may take a while. The culture that we often live in sometimes will put children aside or not look at them in a certain way that can be very positive. So for example, we've grown up with ditties like, children are to be seen and not heard. That's a lie. Another ditty is, sticks and stones may break my bones, but names will never hurt me. That too is a lie. And oftentimes the child needs to know that they have a voice. That little girl, that little boy, that adolescent needs to know that they have a voice, and you may be the only one that they feel they can express that voice to in their life. And that's a very important challenge as well as a privilege.
Being a licensed professional counselor, I've been in this field working with kids in their community, specifically in their homes, in their schools, also in residential facilities. And I've been doing this for about 16 years. And in doing that, you definitely learn to develop what you're good at and what you really work to achieve. One of the things that I feel like is your basis for what you're doing with kids and the families is building rapport. That's really the foundation where you're working from. And in that building rapport, you really want to make sure that the family and the clients feel respected, and that you are working to help understand them and the position they're in, and then also understand the full concept of what they're working through and really where they want to be, the goals that they want to achieve. And then also one of the things you learn early on is also parent involvement. Because you're working with children, sometimes as young as 2, 3, 4, all the way up to an 18-year-old, parent involvement can be quite tricky. You have some parents that are very, very involved, and they want to be involved in every aspect of what you're doing. And then you have some parents that they see the client as the identified problem, and they just want you to kind of fix the problem. And so kind of understanding what your role in that is as the counselor or the worker, the church person, you know, whatever your role is in it, working to kind of bring the parent along and have them buy into the treatment as well as the treatment that you're offering to the client and the child or adolescents. So I would say those are your general challenges in what you're trying to achieve in helping the client in these different aspects.